Alright, very good evening here. Today we're going to go through this module, this topic under biochemistry, nutritional biochemistry, called biochemical assessment. And the objectives of this is that you have to know biochemical test and define nutritional status assessment, and then we get to know what are the biochemical, the laboratory tests that we can have. And going ahead, we should have to understand this question: what is the theoretical basis of biochemical test? We should be able to understand that. Then how do they differ from the ACD methods? So ACD methods, like you have anthropometry, clinical and data assessment, and hopefully nutritional status assessment have covered up all these modules. The module of nutritional assessment have covered up all these topics, and anthropometry, clinical, data, and even biochemical. So here in the nutritional biochemistry, we are going more into a more detailed explanation of what they call the biochemical assessment. So you get to understand with the knowledge from this topic, you get to understand the difference. How is it different from the other methods of nutrition status assessment? We get to know what functional tests are, and then we give the examples of these tests. We get to know also what static tests are there with examples, and you should always be able to understand why you need to perform biochemical tests. And now to start to go a continuation and to continue with our lecture, the biochemical assessment. Biochemical assessment involves measuring nutrient levels and their metabolites in a person's blood, urine, stool, or other tissues. Taking instance, you need to measure the level of calcium, the level of vitamin D, the levels of iron in your body, and you measure them. It's either you measure the nutrients or some of these metabolites, because these metabolites end up becoming some of these biomarkers that you can use in your body. So taking for instance, you want to measure glucose is already a metabolite that is something that has been synthesized into its simplest form. So it's no longer a nutrient. The nutrient is a carbohydrate, but yet the final thing is a glucose, a form of that's just it. So you measure either the nutrients itself or the metabolites in a person's blood, urine, stool, and other tissues. Those are just samples. The tissues can include what you do in a liver function test. There's what you call biopsy, where you just cut the tissue and take it, which can be mostly liver biopsy, because the liver has the ability to regenerate. We even have the skin biopsy in some conditions where it can be taken and assessed in that manner. So these reflect the most recent and long-term nutrition of an individual and can give assessment regarding specific nutrients. Whereas other nutrition status assessment methods like clinical can give you only long-term. This gives you a more recent, and it can give you as well the long-term nutrition of an individual. Take an instance, if today I didn't really take in a lot of foods that are rich in vitamin D, they can assess me and find out today that right now my body is deficient in the vitamin D. And yet tomorrow, if I do that, if I take in and they do the same assessment, the results will obviously be different, that I already have more. I have a clinical for something, for it to manifest, and so it has been a long-term thing. Yes, and then when we look at anthropometry, where we have issues of stunting, that will give you results for a long-term deficiency. And also, if we look at wasting and underweight, those are acute. So it reflects on the most recent and the long-term nutrition of an individual, and can give assessment regarding specific nutrients. Whereas we have some issues when you look into clinical assessment, you can suspect a condition or a deficiency, but for biochemical assessment, this is more like final, and you say this is exactly what it is. And also it's a confirmatory test that is carried out to confirm clinical anthropometry results. That's why when you reach the hospital, the lab, whatever they do in the laboratory, that's exactly what you call the biochemical test or assessment. So analyze results from biochemical test. Biochemical analysis need to be compared to standards of the different nutrients. Yeah. So the biochemical tests are useful adjunct to the anthropometric measurements and clinical assessment. So we use this in regards to your clinical and anthropometric assessment, because you cannot conclude that you need to do a biochemical assessment when you don't really suspect anything. So one is that you first need to do the anthropometry, you need to do maybe some clinical assessment and dietary assessment especially, and then you can get to say I'm suspecting this person deficient of a particular nutrient, and then the biochemical assessment will be able to give you a conclusion about it. That's one of the importance of these biochemical measures. And the second is that the biochemical measures or assessment will confirm suspicions of long-term deficiencies. You suspect someone to be deficient of a certain nutrient, you're definitely going to do the biochemical test. Wait a minute, sorry about that. Need to confirm something. Okay, it's fine. And it also detects the subclinical deficiency states, meaning the deficiency state haven't reached to manifest clinically that you can see that there's a deficiency, but this can detect it so fast that before even it becomes severe. And it is also an objective measure of nutrition status independent of emotion and other subjective, subjective factors. Just for example, objectives here means it is something that is more scientific and that's not based on the person assessing. However, when you look at other things like the clinical assessment, it is based on you. Someone I can see the same person as having pallor. We may have the same person. I come and see that the person is having a pallor on the palm or the membranes, but another person can come and see the same person that I've said is having pallor and conclude that that person is not having any pallor. So it depends on how you really think, how you feel about it. That is for clinical, but for biochemical, it is never dependent on such a feeling. It is more scientific that the analysis is done and then everything is given and you conclude. Types of biochemical assessments, there are basically two, which are static and a functional test. So static, this one measures either a nutrient in biochemical fluids or tissues or urinary excretion rate of nutrient or its metabolite. So this basically measures when you see you're taking samples of the blood, urine, saliva, sweat, and many more. I think even the feces, your feces. So that is a static measures or static test. It is useful to identify secondary or third stage in development when fluids and tissues are depleted of nutrients. And when you see that there is less in your blood, that is already a secondary or a third stage of what? Of deficiency going into. Then the functional test here, it goes so much more into the measure of extent of the functional biochemical or physiological consequences of nutrient deficiency. And now this measures into the functioning of our system. Someone who is going to do liver function test, renal function test, those are already the functional test. That a certain nutrient has affected the functioning of an organ in your body. So the functioning of that organ is what is measured, for that matter, in the functional test, rather than measuring for the nutrient. Yeah, so if we know that someone is having high levels of sodium and it is overloading the kidney and may result into renal failure, they get to measure the renal function test and then that is exactly what it is. So the measure substances that indirectly reflect the level of nutrients in the body. So it measures other things rather than the exact nutrient, and it is used to detect later stages in development of nutritional deficiencies. And this can further be categorized into biochemical, functional, physiological, or behavioral test. So the functional biochemical test here, it measures abnormal, it's more or less like a static. It measures some abnormal metabolic products in your blood or urine samples from a deficiency of a nutrient-dependent enzyme. Some nutrients, some enzymes. Let's look at if your body does not have a certain enzyme. Let's look at niacin, which is synthesized from tryptophan. So if your body doesn't have those enzymes that are available, it will be a problem that you have some kind of a deficiency in niacin. Either way, we still have another example here because some of these things act as cofactors. So let's look at erythrocyte transkerotase activity that is needed for thiamine. It needs thiamine. So if you measure the activity of erythrocyte transkerotase activity in your body, and you find out that it's not functioning well, that will directly indicate that there is thiamine issues. So that will give you at least a conclusion that you need to work on the thiamine levels in your body because of the deficiency. The example here is the growth or developmental responses, especially sex maturation for zinc, abnormal metabolic products in blood or urine from reduced activity of nutrient-dependent enzymes. So if your body cannot metabolize glucose, then the levels would be obviously high. So those are some of the kinds of the functional biochemical test. And the functional physiological test here is more directly related to disease mechanisms or health status. For example, goiter. If you find out someone is having goiter, directly that test and prove that someone has the goiter is what detects that that person has some low levels of iodine, as in the deficiency of iodine as in a nutrient, and also the high levels in the blood of parathyroid hormones. Example of a functional test is the abnormal metabolic products in blood or urine due to reduced activity of nutrient-dependent enzymes. You should be able to understand this because up there in the beginning there are some questions that have been related to this. So I believe we now get to understand some of these examples and everything. Then there's changes in the blood components because the whole hemoglobin for assessment of iron. You can take the hemoglobin, you assess it, and it can help you deduce what? Deficiency of iron. So then in vitro test of in vivo functions like lymphocyte proliferation for protein, energy, zinc, and iron, if you find out this test that the lymphocyte proliferation is not really sufficient, lymphocytes are white blood cells, and it's not really as expected, meaning there is some deficiency in protein, energy, zinc, and iron. Then there is load and tolerance test and induced responses in vivo, for example, zinc and manganese tolerance test. These are tolerance tests actually are what you give the person that exact nutrient and you measure at a particular intervals to find out. Then the growth and development responses, like I think this has been mentioned earlier, but it gives you things like sex maturation for zinc. So you measure somebody's functionality. If their functioning is not really good, the growth velocity, if someone is not attaining the height or the weight or the level of growth as expected, then you can deduce the deficiency for protein, energy, zinc, and then there's also cognitive functions. Performance, if someone is not really doing well cognitively, the reasoning and the mental functions is not really good, then you can deduce iodine, zinc, and vitamin B12 deficiency in the body. Now, what are the steps for biochemical methods and laboratory investigation? That is specimen. One is the sampling. You do sampling. These review appropriate test description, including specimen type, the volume and the procedures, the patient preparation, storage, and handling of these instruments. Then this step one is getting the sampling. So on sampling, I think I should try fixing up something here so that you get to understand that. Sorry. That is one. Sampling is the one stage. 2 is the second step, is the storage. Third is now the preparation, and then fourth is the analysis part of it. I think I need to do that. So these are basically the steps that are involved or followed during the process, this process of biochemical assessment. Yeah, hopefully that's all. Yeah, so let's get to it and understand this concept here, that the steps are: 1, you first do sampling. This involves the review the test, the test descriptions, which include the specimen type, what kind of specimen do you need, how much volume of the sample do you need, what procedures are you going to take to collecting the sample. You prepare the patient ready for the sample collection, and then how are we going to store this sample, and then how are you going to handle it. If it's blood, how are you going to handle it, and everything. And the second stage is the storage. You have to tightly, things like carefully tightening the specimen container lids to avoid some leakages, because once you don't store these samples very well, there is an alteration in their results. And then there's preparation. How are you going to prepare these sample views for analysis? And then after that, this includes labeling it, putting there the name, date of birth, the test request form number, even the time that the test have been requested. In some containers, they do put it there. And then finally, you get into your analysis and you start analyzing your results. So, okay, you need to be careful about all these stages of analysis. So, for safety and to avoid some contamination of the samples. Then the types, the specimens that are used in biochemicals analysis commonly are: 1, blood. This is needed for testing of hemoglobin, trace elements, glucose, vitamins, and we have also proteins that can be tested there. And some of the common tests for proteins include the serum albumin, transferrin, prealbumin, carnitine, nitrogen balance test. And these tests are simple and they are very accurate, that anyone can do them as long as you're given the instructions. It's not really something hard at highest university levels. I think most of the nutrition students do have done this, including me at my time of, I think this was during nutrition assessment. Yeah, depends on the institutions anyway. And then the advantages of blood is that it is readily accessible. You just need to get a needle, tie the tonic weight, and then draw the blood. It is easy to analyze the blood sample. It is non-invasive, that you don't really have to do a lot of damages on the person's thing compared to a surgical procedure, compared to doing a liver biopsy, doing a skin biopsy that you're going to cut someone's skin so seriously. Yeah, the limitations is that the fasting and fluctuations may confound the results. When someone is fasting, and also also diet can confound that, and then the dilution also, if you're taking a lot of water and everything, so the results can be confounded in a way that results may not be accurate for that matter. And we have precautions that you can take over this, is that collect and handle under standardized conditions to ensure the accurate results and precise measures. We look at the fasting and fluctuation from variations levels, that is daily variations, levels of nutrients or their metabolites vary with time of the day. At the beginning of the day, glucose levels are low and they go up after a day. So in the morning when you wake up, levels are low, but as you eat, as you maybe spend during that day, you spend your time during that day, your glucose levels tend to go up. The body has a physiological process of doing all that. And a milk consumption is also one of them during that day. Can raise up hydration status. This can lead to dilution of the nutrient in the blood, so meaning they affect your results as well. Use of oral contraceptives and medications also affect the nutrients levels, some of them. and this can result into confound or inaccurate results that you can have. Infections too and inflammations affect this thing because of it affect metabolic use and loss of certain nutrients and sample. Yeah. So we look at precautions of use for bloods again. We have the plasma and serum. They carry newly absorbed nutrients and are thus being transported to the tissues and thus tend to reflect to recent dietary intake. Therefore, plasma nutrient and serum nutrient levels provide an acute rather than long-term biomarkers of nutrient status. So whatever is in the blood, that is providing more of an acute form of deficiency in the own nutrient status in your blood, because there is a way how everything can be transported from the tissue to the blood, and everything can be regulated in the system. So whenever your body gets so deficient and you detect that in the blood, something that is more recent and it's kept constant. So nutrients are absorbed from your blood to tissues, and once you have a deficiency, then you have to understand that from the results that your blood levels are low. The effect of recent dietary intake on plasma and serum nutrient concentrations can be reduced by collecting fasting blood samples. We have heard of the fasting blood sugars, which is taken after about 8 to 12 hours of fasting, meaning you tell someone in the evening, after your supper, don't eat anything, come and we take your blood glucose levels. That's very important, and because it gives you some kind of accurate results. The risk of contamination during sample collection, storage, preparation, and analysis is a particular problem in trace elements actually, and so these trace elements are present in low concentrations in blood but are numerous, ambiguous in the environment, so they can be everywhere in the environment. So you need to be careful with them, and the containers should be tightened up, so closed and everything, so that you can prevent confounding or contamination from the environment. If you overexpose it, it is risky that you're possibly going to get wrong results. Then in addition, for certain vitamins such as folates and suitable antioxidant must be added to sample to stabilize the vitamin during collection and storage. Yeah, that is if you're keeping it really for a long time. However, if you're taking it directly for analysis, then that may not be very necessary. Additional confounding factors in the analysis of trace elements in blood are venous occlusion, issues with the blood, hemolysis, use of an inappropriate anticoagulant. If you put an anticoagulant that is not supposed to be used, then it can also confound your results. And then there's collection separation time, the time you collect, how do you take, how long is it you have collected, and how long have you kept it, and the element losses produced by adsorption on the container. Some of these nutrients can stick to the walls of the container, and then others are very volatile and they can be lost during storage. Examples of biochemical tests right here is that we have phosphorus, that we test for serum phosphorus, and the analytic method is calorimetric. We are going to look into some of these analytic methods, though not all. And then we have magnesium, which you test directly for serum magnesium using atomic absorption spectrometry. Hopefully it's part of the slides. And then we have iron, which is you measure for the serum ferritin, and it is a laser, which is enzyme linked immunoassay. I think that Z is supposed to be S, Elisha, hopefully. So other specimens that have been used also can be the urine, the sweat. The urine here you can assess for chromium, iodine, selenium, protein, B complex vitamins, and vitamin C. I hope I'm not talking something that is new when you talk about B complex vitamins. And then we talk about the sweat, you can find out about potassium levels. Saliva, this is a sample that can be used for thyroxine, testosterone, and zinc levels. The breast milk can be used for vitamin A, B6, and B12, thiamine, riboflavin, iodine, selenium, and this reflects the levels in the maternal diet anyway, and not in the child. So if you want to find that of the child, you definitely have to assess the child's blood sample. Yeah, because if you do breast milk, you're getting directly what the mother has. However, for a child who is on exclusive breastfeeding, you can conclude that this child, whatever is in the milk is what she has taken, and that is what she has in the body. And this can be subjective, and it is not fully accurate compared to doing a real test on the child's blood sample. When you look at also hair as one of the sample, it is for trace elements like zinc, selenium, and exposure to heavy metals such as mercury and arsenic. The toenails here can deduce about selenium. The buccal mucosa here is the lining of the cheeks and the back of the lips inside the mouth. Can detect for alpha tocopherol status, that's vitamin E, and then the folate status. Adipose tissue, this one's the fat soluble nutrients, which we already know, they are DEC. Fatty acids, vitamin E. The liver and the bone is for iron and calcium as well. Yeah. However, the liver has a lot of nutrients that it stores, so it can deduce for us a little bit more than just calcium and iron. So we need a biochemical assessment here. More of the example still here is that calcium, we can test for serum ionized calcium. That is the iron-specific electrodes method, analytic methods. Then the phosphorus, like we discussed earlier, calorimetry. Magnesium, we discussed it already, and we can do that. There are two methods right here. Copper is still here, and you can have a lot of time to interact with these notes as you get access to the Google Drive notes, and then you download them and get to start them into much more details and understand. Iodine is as well here. The iron, the zinc they're all here. So you get to understand each of these methods and how they analyze each of these nutrients and analytic methods, and then the test that you need to do on each of these nutrients. Still, right here we'll go into nutrients. The fat and water soluble vitamins are also here. Right up there were minerals, and here we have the vitamins. And some of these analytic methods have been abbreviated, so the full meaning of those abbreviations: AAS is atomic absorption spectrometry, ELISA is enzyme-linked immunosorbent assay, TSH is thyroid stimulating hormone, one of the thing that you test in your blood. The NAA is neutron activation analysis, that's a method also. The NADP is nicotinamide adenine dinucleotide phosphate. The NAT is nicotinamide adenine nucleotide dinucleotide, HPCL is high performance liquid chromatography. Radioimmunoassay is RIA. The methyl malonic acid is MMA. However, some of these we may not be able to cover them all at once. You have to go further and research more about some of these other methods as you prepare for your exams. The methods, now going into the methods used, that here we are basically going to state the principles that has been used. Hopefully we'll get into the details of some of these methods. One is the spectrophotometry. This is based on the principle that different substances absorb or transmit light over a certain range of wavelengths. It is used to measure the concentration of solids in a specific solution by calculating the amount of light absorbed or transmitted by those solids. This is now more of a physics thing about light and absorbance or transmission of light. Certain all these nutrients, or some of them, may be able to absorb nutrients at a particular wavelength. So the absorbance or transmittance of light that passes through them is measured, and that is exactly what this method of spectrophotometry is based on. So they find out how much the concentration of the solids, possibly iron in a solution, can be calculated from how much light it can absorb or it can transmit through itself. Then immunological methods, these methods are based on the principle that substances have specific ability to bind to certain antigens or antibodies. The examples is radioimmunoassay and enzyme immunoassay methods, immunosorbent methods also of analysis. So they are all under the immunological methods. Then chromatography, here we have the HPLC, the gas chromatography and other methods. This one uses this chromatography, and their functioning is based on the principle that substances have differences in chemical characteristics that allow them to isolate from each other. Yeah, so this chromatography, like we have just known how an ink separates itself. I think in high school or level, in the senior one, when you learned about chromatography in chemistry, I think that there are some extra schools that did an experiment that you put an ink on a paper and then you pour alcohol on it. You will see that the different colors in the ink start separating. You end up realizing that a blue pen doesn't only have a blue color. Yes, but the overall is that it became blue. So let's look into some of these nutrients, how you analyze them. Biochemical assessment of zinc. One is the function of this is that it's required for cellular metabolism. Yeah, many enzymes require zinc for function or regulation. This zinc also maintains the structure and synthesis of and also degradation of these nucleotides, RNA and DNA. And zinc too is essential for cholesterol metabolism as one of the major nutrients needed in that process, and the maintenance of lipids within cell membrane. Carbohydrate metabolism too needs zinc, so zinc deficiency may cause impaired glucose tolerance, which is essential for hormone activity in your body, and that particularly insulin. And zinc is also required for optimal functioning of the immune system. This is one of the booster, and it's also an antioxidant, by the way. And zinc deficiency can lead to disturbance in the cell replication and differentiation process, as it's involved in the process of protein synthesis and DNA replication. So once it's deficient, then you definitely have to suffer the consequences that to disturb that process. Zinc is one of the most prevalent nutrient deficiency worldwide. True, that many people have deficiency in this, and there is no specific biomarker for zinc status, but you just measure the serum zinc, how much zinc is in your blood stream. So they reflect dietary zinc intake. Whatever results you get will reflect what someone takes in. So if you assess that someone is low in deficient in zinc, yeah, that can give you a conclusion that this person does not take in a lot of zinc-rich foods. Yeah, and it responds consistently to zinc supplementation and reference that are available for the most age and sex groups. About this thing, you can find out how much zinc someone takes on RDA, how much supplementation. You have also the functionality, how important it is, especially for sexual activity. It's also one of it. It's a very good antioxidant that you will need for this. So this knowledge that we have about all these micronutrients can help you develop a product that can solve a great deal of diseases for sure, and you have to work on that, so that would be a very good project. And zinc is one of the most prevalent nutrient worldwide. There is no specific biomarker, and it also zinc serum reflects, and I think that should be a repetition. What about the analysis? That clean subjects' hands at point of antitubital vein. That is one of the steps of sample collection. They clean subject's hand at the point of antitubital vein. So we have some things for cleaning your cotton wool, or you have also these wipes that are ready. They are called alcohol wipes. They are ready for use, that they have the ethanol in them, and you just wipe the area that you're going to inject or draw the platform, and in this case it is an antitubital vein. So you draw the blood using a stainless needle and collect into a blood collection tube. After drawing in the blood, you place the blood sample in the refrigerator to clot for about 30 to 40 minutes, and then centrifuge the blood sample at around 2,000 to 3,000 grams for 10 to 15. That's gravity for the centrifuge for 10 to 15 minutes, and then you discard the hemolyzed sample. So dilute the sample 5 to 10 folds in either 6% aqueous butanol or 5 or 10% aqueous propanol solutions. And finally, you read the sample zinc concentration using atomic absorption spectrometry with appropriate dilution, again a standard reference material. So you get to dilute the sample. This 5 to 10 folds means you dilute the same sample. You dilute with 10 mils. You get some mils from that diluted one, you dilute again. You get another one from that second diluted one, you dilute again. So you dilute that 10 to 5 to 10 times in different test tubes, and you measure now how much is there. You use 6% butanol, aqueous butanol, or 10% aqueous propanol solutions, and then you can now finally find out the absorption, the concentration using this method of atomic absorption spectrometry. Yeah, so how about the urine zinc? That was in blood. How about the urine zinc? Now, urinary zinc excretion is constant over 24-hour period. Usually excrete this zinc. So urinary zinc will decrease in case of extreme severe deficiency, but is unaffected in mild zinc deficiency states, but increase with high dose. So the high dose, if you have high dose of zinc, especially if you supplement with zinc, you find a lot of it in your urine. And if you are deficient of it, the levels will be very low in your body. So this implies urinary zinc excretion is only sensitive to extremes of zinc intake. So during normal levels of zinc, you cannot really find zinc in your urine, unless you cannot find a lot of zinc that exceeds the normal in your body, unless otherwise. But usually, if you have taken in supplement, a lot of it will be excess, will be lost through the urine. Or if you're deficient, then the levels will be so low in your urine. So this will imply now that zinc detects extremes only at a very low and at very high doses. So in addition, zinc here can be confounded by sickle cell disease and the liver diseases and some renal diseases as well. Infection, burns, and alcoholism can affect the results that you can get from those things. Urine zinc. How about the hair? As it is, zinc is involved in growth, development, and everything, so and metabolism. So what happens? This will reflect a chronic suboptimal zinc status, meaning if your levels have not been really that normal for quite a long period of time, because you cannot have a zinc deficiency today and your hair changes. So it takes over a certain period of time that it start reflecting that this man has not been taking a lot of zinc in the body. How about hair? It's collected from the occipital portion of the scalp. You just see as towards the medulla here behind. They collect that hair, and then the hair zinc increases with supplemental zinc. Once you have a lot of zinc, a lot of hair is if you take a lot of supplement, a lot of zinc will be formed in your hair, but may decline in children with chronic marginal zinc deficiency. If you've been having that deficiency, zinc levels will also be so low. And some researchers have also reported discrepancies between zinc content of hair and zinc serum concentrations. That if you measure my zinc serum levels and my hair zinc level, they may not be the same. They will be so in totally different things. So there are some researchers have shown such kind of arguments. Zinc cannot be used to where hair growth is arrested. So for example, in protein energy malnutrition, those malnourished children, you cannot decide and say, let me use their zinc for analysis, because it is confounded that is also affected by protein deficiency. So hair zinc is influences by sex. It is lower among boys, and it is hair and high with girls. Then there is hair color can also affect. Hair beauty treatments can also affect that you have treated your hair so well, and it has also increasing the levels of everything. Enzyme linked immunoassay ELISA, one of the analytic methods that an immunological assay commonly used to measure antibodies, antigens, proteins, glycoproteins, and hormones in the body. And it is also a method of target antigen or antibody. And captures in samples using a specific antibody or antigen and the target of molecules. And this technique here is generally used in medicine to detect the antigens or antibodies in the serum, proteins, and is also immune diagnosis. So you can get to know how your immune functions through this immunoassay. So you can also get to know the infectious disease, how much they have really affected your immune system through this method, because it checks on your antibodies and antigens levels in your body. The types of ELISA tests will depend on your antigen-antibody combinations, and this may include the direct ELISA, indirect ELISA, sandwich, and competitive ELISA, which can be of different functions. So ELISA generally have a high sensitivity and reasonable specificity for the detection of proteins amounts with concentration ranges from ranges of, I think this is supposed to be 10 grams per mils to ng to this in serum, n grams per mils to p grams per mils in serum, which is something that is not really very specific. ELISA here is a plate-based assay. You look at what a plate is, plate-based assay. So it is designed for detecting and quantifying peptides, proteins, antibodies, and hormones in your body, like we stated earlier. That is its principle of operations. So various antigen-antibody combinations are used here, that you bring in different antigens, you bring in different antibodies, and you combine them. So all those combinations will help you. And at the end of it all, there's an enzyme activity that is going to take place, and you measure. And that activity will result into change in the color of the product. So the change in color, the intensity of that color is what determines how much a nutrient is, or how much something is, a hormone or a protein is in that body. If you're doing protein analysis, then you have to, the changes in that, the intensity of that color that has changed gives you how much protein is in your body. So this can be basically used for the serum, albumin, and all that. So this will evolve later in colorimetric measures that will detect the color changes and how much it has changed. Then it change it into numerical, because first you have just color intensity changes, and yet it has to be translated into a numerical figure that you can give out. So in ELISA, an antigen must be immobilized. Immobilized meaning it can't move to anything. You just fix it at a fixed place on the surface that looks like a plate, and then it will be complex with an antibody. And that antibody has to be linked to an enzyme, maybe an enzyme that digests proteins, so that when that reacts, the protein is dropped in your sample. There's a kind of digestion that takes place, and then brings into changes in the color, and this will result into the detection of a color, and then which will be determined using the colorimetric method. For you to be able to determine everything, how much is there colorimetrically, you can measure the change in the color intensity to define yourself. And this is just a workflow of everything. Here is that you immobilize your antigen or your antibody, so that you bind it to a surface. Then you add your sample, and the sample that already contains your what, and then you wash the microplate. After adding the sample, you wash it off, and then later on you add the detecting antibody you add the antibody on that, and then you wash it away, you wash it off, so that only you have that antibody being bound to it. And then after washing it off again, you add now your substrate. Now that I want to detect your protein levels, you pour now what the substrate that you're going to detect, and then you read the microplate using this, and then you can also use the calculate the results manually, or there are also other technical methods of doing the calculations using a machine, and then your softwares, and then finally your results will be read off automatically. So these are automated machines that can run this. Another method is the radioimmunoassay. This is highly sensitive way. It is used for measuring of antigen. Like we said earlier, that ELISA and RIA, these are immunoassay methods. So they use antibodies, antigens. Yeah, just like so RIA here, just like ELISA. ELISA here is using also antigen, antibodies also. So in this assay, a quantity of antigen of interest is tagged with the radioactive isotopes, mostly iodine 125 or iodine 131. These are isotopes. These are tagged and labeled with some labels. They are labeled that you can identify them. So you mix them with a known amount of cognate antibodies. The antibody that is cognate, that is I think compatible with the antigen. Bind them together, that's something that you recognize, so it is bound together with the iodine and everything. Then as a result, the radio labeled antigen, and the antigen which is been labeled with this iodine and everything, and then the antibody which is specific and binds to this antigen, they will bond one with each other, and then later the sample of serum that contains the unknown quantity of the same antigen is now added. If you want to know same antigen, you add it there, and this causes the unlabeled antigen from the serum to compete with the radio labeled antigen for antibody binding site. Now if they have the same antigen and they need the same antibody site, meaning once you pour in that sample, it will be able to displace the antigen that you had put before. So how much of this antigen has been displaced will give you now the conclusion that about your results. As the concentration of unlabeled antigen increases, more of its bind to the antibody. So those that you have from your sample, they are unlabeled. However, in your setup now, you already have the labeled one, so you're going to see a form of competition, and the labeled one are going to be displaced. So at the end of the procedure, the bound antigens are separated out, those that have been bound now. And then ultimately the radioactivity of free antigen in the remaining supernatant is measured using a gamma counter. So you will be able to get the sample back, separate those that have been bound, and then you come and measure how much of these free antigens in the remaining supernatant is been. So you can do is been left in your sample. So you can do that using a gamma counter. And the details of the general working of the radioimmunoassay is that in conducting the radioimmunoassay, a known quantity of antigen made radioactive is mixed with known amount of antibody to chemically bind to one another. So what happens? When serum sample with an unknown quantity of unlabeled antigen, the one in the question of course, is added, the two compete for the antibody binding sites, like I said earlier. Now at high concentration of this unlabeled antigen, which is actually in the sample, you say more of it will bind to the antibodies, and it will displace this one of the radioactive variant, the one that has been labeled with our iodine 125 or iodine 131. And then the result is gotten by measuring the radioactivity of the amount of the displaced labeled antigen. So you see how much, if you can find how many of these displaced antigen are there in your remaining solution after separating everything, then you'll be able to understand how much of this is there. So this is basically what the flow, and you get to understand it in too much detail, that here you had there your buffer in the tubes, and then you add a known amount of the unlabeled one, and then you add radioactive antigens, and everything, and then later on you go and add on a fixed amount of antibody to the tubes, and then radioactive antigen will be displaced here, like the way you see antigen 1,5 analysis. So antigen is right there, so everything radioactive antigen is displaced from the antibody molecules by the unlabeled antigens. Now step 6 is that the antibody bound antigen is separated. You start separating them, those bound from those unbound, and then you go and do your gamma counting. The high performance liquid chromatography, this is a chromatography method of analysis, HPLC, analytic techniques that is used to separate, identify or quantify each component in a mixture. So you have a mixture of things, so you need to separate them, and then you quantify. You separate them, which one is there, how much is there, which one, everything. So this mixture is forced through a separation column at high pressure up to around 400 atmospheres. So you use your high pressure and force everything out of it, go through it, so that you get to understand. So once the sample is forced through a certain separation column under high pressure, it now brings in now the separation thing. Then here purification takes place in the separation column. They will be purified. So those that are stationary, meaning granular, will be separated away, and then also those that are mobile phase, like the solvents, they will also be moving to their own. And then the components of the samples are separated from each other due to the varying degrees of interaction with the absorbent particles. So they interact differently, so they end up separating into different layers, let me say layers, or according to what they really are. If you have sun here, sun separating. If you have something else, sugar separates to its own, just according to their interaction with the absorbent particles. So that was an analogy with the sun, but in real life we are dealing with the micronutrients and other nutrients in your body. So individual components of the sample will now migrate because they are retained in the varying degree. So in the phases, they have in the stationary phase, they will be retained according to their varying degrees. So after leaving the column, each individual substance will be detected by a suitable detector, and then they will be passed on the signal to a software of HPLC on your computer, and it will read for you everything. You don't need to do some manual calculations or everything. And HPLC here, the advantage is that it is a high speed, it is efficient, and it is accurate, and it is versatile and precise. However, the disadvantage is that it is very costly, it is very complex in operation and functionality, and then volatile substances are required as require gas chromatography. So what is this? Interpretation of the results of generally of all these biochemical processes, that when you find out that there are low nutrient levels, you deduce poor data, you suspect dietary deficiency. Actually, you conclude that, because with the biochemical assessment, it gives you actually final results, confirm something. You will now conclude dietary deficiency, there's a poor absorption, or else there's an impaired transportation, and there's also abnormal utilization and combination of these factors. So you can get to understand this in that way. So you can compare individual results with normal reference values, so according to, and also for the age, the sex, and the physiological states, all of them have their different reference values, and you can stick to that. Otherwise, thank you very much, and we have come to the end of this lecture, and see you in another lecture. Thank you.